I'm going to just start out with some basic questions. Your full name and your date of birth and where you were born.
It's James Edward Bennett, May 19th, 1925, Burlington, Wisconsin.
Okay. 1925 makes you how old? I'm going to be. You told me earlier, but
Well, I'll be 90 next May.
Okay, wonderful. Okay. And your parents' names?
My father was John Francis, known to everyone as Frank, and my mother was Florence Elizabeth Maurer when she married my dad. She was a school teacher. My dad was an MD, a general practitioner, general surgeon.
Okay. And the old-fashioned type of family practitioner that did surgeries and delivered babies?
He was a fellow of the American College of Surgeons, believe it or not.
Okay.
Despite the fact that he had no formal surgery training. That couldn't happen today, but it did then.
Okay. So did you make rounds with him?
But I was in practice with him.
Okay, but when you were growing up, did you ever?
Yes, I can remember going to the operating room and the ether made me a little wheezy because there was open drop ethers what they used.
Yes, I remember. That's how I had my tonsils out by a family practitioner, by the way. Okay. So is that why you went into medicine? Is that an obvious question, or?
I actually, to give a little history of World War II and college education, with the draft being pretty all-inclusive, it was obvious that down the line, depending on how long the war lasted, there would be a shortage not only of physicians, but dentists and engineers and all sorts of talented people. So the Army and the Navy established some college programs. And I chose the Navy, and I was sworn in right after graduating from high school in May of 1943, and I was sent to the University of Notre Dame to be educated.
Okay. So you were educated at the University of Notre Dame and then went to medical school.
Well, I'm skipping some parts here. I was not classified as a pre-med, and I wanted to be in pre-med.
Oh, okay.
So there were three of us in that boat, and we went to see the educational officer, Lieutenant Beatty, and he said, well, I'll try to get you guys into pre-med, but in case you don't make it, you'll have to choose something else. So he talked me into choosing meteorology. And I didn't get pre-med, I got meteorology. And I was sent out to MIT to study meteorology. And after about a week of classes out there, I went to their educational officer, Lieutenant Fawcett, and introduced myself, and I said, Lieutenant Fawcett, I don't know what they're talking about in these classes. There's absolutely no chance that I could satisfy these requirements. So he got me transferred to pre-med, and there were 5 of us in the pre-med class at MIT, which was it was rather unique, and some of the professors we had hadn't taught at the undergraduate level for a long time, but they were pretty bright people.
Mm-hmm. Okay.
And then the Navy established these criteria for going to medical school, and they were not very uniform across the country. They were particularly tough in I think it was the 1st Naval District in Boston. But I did make it to medical school, and I was sent to Creighton in Omaha, starting there in September of '45. War was over, we all got out of the Navy that December, and during the ensuing 6 months I was able to transfer to Northwestern.
Okay. Now you have children?
Yes.
Okay, would you like to mention your children, grandchildren, great-grandchildren? You don't have to name all of them, but I'd be interested, and then you can talk about it.
Go one generation. I have 4 daughters, 2 sons. They're 3 sons. They're except for one, they're all in their early to mid-50s. And the young one's starting grade school this fall.
The youngest, the grandchild.
Yeah.
Oh, wonderful. Okay, okay. Any of the children in medicine?
No, but my oldest son's older daughter is a senior in the School of Veterinary Medicine at Purdue. So she's the closest to following a medical career.
Okay, okay. Wonderful, okay. How did you, is your wife still with you? I didn't talk to you, but I wanted to ask you how you met your wife. It doesn't matter, so it's much.
University of Michigan in general surgery, there were a couple of outlying hospitals in the state that had teaching programs for general practice residents. And if you were unmarried, you could bank on getting sent to one of those for 3 to 6 months. And I was sent to, I knew I was going to get that call, so I went to see Dr. Buxton, one of the faculty who was in charge of this, and I said, I know I'm going to get stuck, can I have my choice? And he said, yes, you're the first one here. And I said, I'll take Benton Harbor in the summertime on Lake Michigan, which I did. Well, I completed that 3 months and got back, and I was going through the cafeteria line, and I saw this blonde nurse that I had not seen when I left there, and that's the beginning of the story of my courtship with Ellen McPherson.
What inspired you to go into plastic surgery per se? And we talked a little bit about it, but who were the mentors that led you that way?
There were several, but I think the main one was Dr. Reed Dingman of Ann Arbor, who was a wonderful guy and a superb surgeon. And in my research year, I did some research that was related to a topic that he was interested in. He remained till his dying day, really. I considered him my primary mentor in plastic surgery.
And why did you like the field? I mean, what was it that attracted you?
I was interested in surgery of the injured patient.
Okay.
Which isn't what people today associate primarily with plastic surgery. But orthopedics didn't particularly appeal to me. And I knew that plastic surgeons did get involved with congenital anomalies and particularly injury, soft tissue injury.
Right.
And I think that was the main thing.
Yeah. You've seen momentous changes and paradigm shifts in plastic surgery during your career. What do you stands out? What things, either yesterday or 40 years ago, things that have changed?
Well, I think transfer of tissue became more and more sophisticated with the passage of time, from simple random pedicle flaps to vascular pattern pedicle flaps to free flaps of various tissues, muscle, skin, a combination thereof. So I think the tissue transfer underwent, during my plastic surgery lifetime, quite a metamorphosis. Of course, the one that people know about, even more dramatic, with perhaps not as many applications, is craniofacial surgery.
What do you think is the greatest mistake our specialty has made?
Being based at a medical school, at a university, in a way sort of protects you from some of these strayings into facets of plastic surgery that are less attractive. I don't want to badmouth cosmetic surgery, because cosmetic surgery, aesthetic surgery, whatever term you want to apply to it, can be very helpful to patients who really need it. And it was not my favorite subdivision of plastic surgery.
Okay. What do you feel is your greatest professional accomplishment?
Educating 60 residents.
And hundreds of thousands of lives, touching them through that.
I really enjoyed, particularly operating room and bedside teaching. Lectures were all right, but it was really up close education.
Right.
And I tried to devise my program to truly give graduated independent responsibility. And you learn quite early that not everyone graduates at the same level. And I had several wonderful residents, but at the end of the first year of 2 years, they didn't have any more independent responsibility than they did at the beginning, and I couldn't allow them to continue into the second year. There were 4 this way. They all got other residencies, all completed their programs, all were certified by the board. So they found a program that was more suited to their abilities and progress.
Who do you admire most, professional or personal? You know, 1 or 2 people that stood out in your life that you may have mentioned them already, but.
Well, my dad and mother to begin with. I mentioned Reed Dingman, who was my mentor. Dr. Harris B. Shoemaker was chairman of the Department of Surgery when I came to Indiana in '64. Marvelous man, marvelous. Truman Blocker.
Okay.
Truman Blocker was a big man physically, and he was a big man in accomplishment. My last year in Galveston, I had my plastic surgery there. He became chief of surgery. And then he became, in a year or 2, head of the entire medical branch on the island. That's a big job. Mm-hmm. And I'm sure he did it well.
Your words of wisdom for present and future generations of plastic surgeons.
I think of education as a continuum. And you can start wherever you want to, but medical school, internship, residency, and usually general surgery, then plastic surgery. I think fundamental tenets of surgery are pretty much the same through that continuum once you start to be a surgeon. In plastic surgery, more of it meets the eye than in much of general surgery, which is visceral. But I think the same principles pertain. Those of a correct and appropriate diagnosis, and then the outline of suitable treatment. Those principles are the same in surgery and in plastic surgery.
Okay, your words of wisdom for retirement, because you told me some interesting stuff.
Well, I think there's no one size fits all here, but facing the day when you're no longer going to go to the operating room, you're no longer going to make rounds, you're no longer going to see patients in your office, you have to find something that is going to whet your appetite as far as intellectual, or maybe not even intellectual, as far as pursuit of occupation, and I happen to be horses and a farm, which even today keep me about as busy as I want to be. But I think the idea is to plan. Don't pretend that day isn't going to happen, because it is. If you live long enough, it's going to happen. Death will take you away before you have to deal with it. But it's going to come.
And I have one final question. Where do you see plastic surgery in the next quarter century?
That's a tough question. At my age, you tend to look backward, not ahead, because you know you're not going to be very far ahead. I think that it can only get better if the training programs are good, and and I've heard, since I've been just in the last few hours before coming here, that plastic surgery residencies, good ones, are more in demand than ever, which rather surprised me.
I'm privileged and honored to have interviewed you, sir. Thank you very
much.
much.